The achievement of ambitious disease prevention, elimination, and eradication targets will require bold strategies to reach the most difficult to reach populations and policies that support country capacity and ownership to sustain health gains. To address this challenge, the Task Force for Global Health is launching a health campaign effectiveness coalition with support from the Bill Melinda Gates Foundation. As the world addresses COVID-19 and many of these critical health services have been delayed or suspended, it's absolutely essential that we find new ways to work together. We believe this coalition can provide that opportunity. As a first step, we needed to be clear about what we could accomplish through such a coalition. This involves questions like, what problem are we trying to solve? What could be improved through this collaboration in real measurable terms? And how can we best work together to affect change? To answer these questions, we assembled a design team of 12 experts from across various health programs, countries, and organizations to work with us to craft a vision and theory of change and to identify strategic priorities for the coalition.
When I first heard about campaign effectiveness and building a coalition around campaign effectiveness, I was a bit skeptical, I do have to say. The Carter Center has been conducting mass drug administration campaigns and health education campaigns for a very long time, so I felt like we were effective. We didn't need a campaign effectiveness coalition. However, there is power in partnership. And when I stepped back and took a pause and thought about the need to bring together others so that we can have more effective campaigns that are perhaps focused on integration, co-impact, or the possibility of building stronger partnerships so that we can effectively treat more people at one time. I stopped focusing on my skepticism and started focusing on the power of partnership and being positive within that, and building upon expertise that from around the world that could be part of this coalition.
I come from the malaria and immunization world mostly, and within that, in the field work that I've done through over 30 years of experience, I see health workers in countries that are pulled from their duties for months at a time sometimes to conduct these siloed vertical campaigns. And I see families and households are overwhelmed by these health workers coming by for these repeated campaigns. And these vertical approaches have endured for a long time, despite the fact that we know that we have some successful models of collaboration.
The individual programs have become very siloed, and this would represent an opportunity, if not a necessity in the time of COVID-19, for programs to begin to cooperate and collaborate more than they have in the past, and to get out of their old habits. To work together more.
Their goal is not one thing. It's bringing all these interventions, all these donors. The donors tend to talk to the Ministry of Health one at a time. But now the coalition has brought the donors, the partnership, to talk to the country in one voice. And I expect that they also listen to what the country wants. So the coalition is not a coalition; it's a partnership between the coalition itself and the countries.
I think there is the opportunity here for the campaign coalition to be transformative in terms of changing the norm out there. First of all, in making multi-purpose campaigns the norm rather than the exception. And the other thing is to use this as an opportunity to improve the positive impacts that campaigns have on overall health and minimize the negative effects or negative impacts on the health system.
They have their clear deliverables, they understand what they need to deliver, their clear timelines. It's a plus. Nobody's doing this. And that's the gap they are expected to fill.
The design team was able to reach a consensus on the need to use the coalition to support countries to use effective health campaigns to overcome the challenges facing in the countries during the COVID-19 pandemic due to the postponement of several communities' activities.
There are many campaigns that have been suspended for many programs or health interventions. Now that the time has come to consider resumption or restarting campaigns, it's more important than ever for there to be cooperation, for there to be collaboration, and very likely co-delivery of multiple interventions in order to get back on track.
The design team for the Campaign Effectiveness Coalition really took a step back and looked at what would be the best governance of the coalition. And so the design team spent some time on governance and also theories of change, which were two just fantastic ways to ensure that as the coalition is designed, it is designed in a way that brings governance not just from this group of experts from around the world, but from the ministries of health and those we serve.
The design team sees the coalition as a forum to catalyze the use of health campaigns as a platform to help health services to catch up and deliver actions in each country as part of the activities to concentrate interventions in communities based on their needs and their context.
There is one overarching aspect of the Campaign Effectiveness Coalition that is going to make this coalition powerful, and that is the power of partnership. It is focused on partnership, it is built on partnership, and the idea in designing it is to ensure that we have exceptional partnership to make the lives of others better in the long term.
What excites me most is the possibility to have a forum to catalyze global efforts to design, implement, and evaluate effective health campaigns based on the best evidence available to help countries to strengthen their capacities to accelerate efforts towards control and elimination of several diseases in alignment with the Sustainable Development Goals to leave no one behind.
I'm grateful for the time and thoughtful efforts of our design team to develop the foundational elements to launch this coalition. I'm very excited for the coalition to begin its transformative work. We have a real opportunity to work together to bring about systemic change that will help public health programs better meet their goals.